professor of surgery of more than 45 years standing. I got 4 gold medals in surgery and fellowship of the International College of Surgeons, fellow of the Royal College of Surgeons of England. And I have treated lot of patients apart from diabetes. But what concerns me most is the diabetic patients losing their foot or their leg. And I am a pioneer of CO2 laser therapy in the world. Now this laser therapy prevents spread of gangrene and avoids amputation. But first you must realize that how do you get an ulcer? Prevention is much better than cure. You have to prevent the foot ulcer, and you can only prevent it if you know that it starts with neuropathy. The nerves die in diabetic. So the patient walking, he must not walk barefooted. If he walks barefooted, he will have no trouble. Hot marble he is walking on, he will get a blister, and blister will keep on increasing if his diabetes level is high. And it will keep on eating into the tissues.
Okay.
It's just like a fish out of water. You have a fish out of water, it will rot. So similarly, the blood supply becomes less. And what makes the blood supply less? Another factor is smoking. So if you are diabetic and if you smoke, you are more likely to get a foot problem. How do you prevent foot problem? Prevent it, detect it early. Tell your patients to wear white socks. If they wear white socks, the night when he removes it, the first drop of blood will be seen by himself or by the maid or by the wife. And that can, once it starts treatment early, it will not go on to gangrene.
Okay.
I have not done amputation of the leg in the last 15 years of my practice, especially for diabetic foot. Number 2, they must be told to change the style. Most people, you tell them, don't eat sweets. Then they say, what is this life if you don't eat sweet? The life can be good. You want to live a healthy life. You want to live a life not dependent on anybody. Because once a leg is cut off, he loses the desire to live because he is totally dependent on somebody else. I have not seen a patient with amputation living for more than 2 years because he loses the desire. He wants to go to the toilet, he needs somebody there. He needs crutches or needs somebody else. He said, what the hell? He doesn't go out, he doesn't mix people. Mentally, he is not right. So, you prevent amputation. Amputation, once you do, it reduces the lifespan of the patient. Because first of all, that much blood is less, there is more load on the heart, and more load on the heart, and psych, which is most important, he loses the desire to live.
More load on the heart?
Yes, because we got 5 liters of blood in the body. Now you lose 1 leg, this 5 liters is going to be
4.
In the 4, there will be increased load on the heart.
Oh.
Increase. So the patient will die of heart problem.
Okay.
So prevent a patient's diabetic can live a normal life. They must be told to control the diet. They must be told exactly what to eat, what not to eat.
You are trying to say that the number of liters will remain the same, but the size of the body reduces.
Yes.
And that's why there is a problem.
Yes.
Oh, I see.
Yes.
Okay.
This probably is news to you.
Absolutely.
Yes. And they die of heart failure. I've not seen a patient with amputation living for more than 2 years. Because
Doctor, another thing is that there is also a feeling that after 15 to 20 years of diabetes, there will the problem with foot will be inevitable. Is it inevitable?
It is not inevitable. You avoid the level of sugar in the body at all times.
Okay. Okay.
And that's why there is one very important test of that which is called glycosylated hemoglobin.
Yes.
Now when you are going for blood sugar and wife gives you jalebi or peda, you say, don't give me, I'm going for blood test.
Correct.
So that blood test is going to be wrong.
Correct.
This is the test
3 months.
3 months average. And you must You must say that I want to be useful to the society. I want to do something for myself. I don't want to be a burden on somebody. You must have the psyche. Then the diabetics will do well. Otherwise they'll say, if I have got mango garden and I don't eat mangoes from my own garden, what is this use? There are many other things.
Sir, can you also tell us about the problem with peripheral nerves getting damaged because of diabetes? Is it also causing problem with the foot?
Yes. Once you lose sensation, have you not seen diabetic? Have you not seen leprosy patient? Leprosy patient have got no sensation.
True.
So if they pick up hot utensil, they don't feel, so they keep eating away. And same thing happens with that. You no sensation, you will step on something which is hot, you will not realize it will be eaten away. So loss of sensation is the primary thing. Number two, less blood supply. You keep the sugar level high, the vessels become atherosclerotic.
Okay.
They become narrow.
Okay.
And the blood doesn't go to the distal part.
Okay.
So the two things added up give rise to gangrene.
So can yoga help, because yoga essentially helps to increase blood circulation? Do you think yoga can help prevent or at least postpone the damage to legs in diabetics?
If you don't follow the advice of food, yoga alone is not going to help you.
Absolutely.
First thing is the diet.
Correct.
Is the sugar level in the blood. And that is directly related to the intake of what you are doing.
But after controlling your sugar, would yoga help?
Yoga is going to help the mind. You desire to live long, you desire to help other people, you don't want to be a burden on the society. Yoga will help in all ways. But yoga alone is not going to help.
Okay. And what about type 1 and type 2? The kind of difference in foot problems in type 1 and type 2 are distinct? You think type 1 problems are different from type 2 diabetes?
No. Once the foot nerves are involved, they can go on to gangrene. You must avoid the foot sugar level in the blood. Whether the patient is on tablet or on insulin, doesn't matter.
Okay. So, can you tell us about the problems related to gangrene? Is it only after an injury that it can become gangrene?
Injury becomes a trigger point. As you say, injury, how I explained to you the leprosy patient.
Okay.
Hot utensil he's picking up, he doesn't realize, and it gets eaten away. Same thing. The sensation loss is there, plus sugar is there, it starts fermenting. Like suppose I do this, nothing may happen to you. But if you are diabetic and you do this, you will get a septic finger.
And very long time it won't get even.
Yes. So sugar is the first thing, and then loss of sensation. And loss of sensation coupled with trauma.
Correct.
Because if you are walking barefoot, so you should not walk barefoot. Avoid, and even there are slippers which are called slipper center one. That is bad. You know what I mean?
Yeah, I got it. Like those old sages used to wear.
In the middle one.
Yes.
And this will rub. This will take the weight, and this will start the ulcer point. And once it goes on, and since you know, see, we testing something hot, we decide not to touch it because it is hot.
Correct.
It is painful. When there is no pain, you don't realize.
Absolutely. Pain is actually a benefit to the body.
Yes.
Okay. Now, tell us about gangrene or any foot problems. After you control your blood sugar, can that be reversed? Can the health be reversed in legs?
See, once what is dead is dead.
Like kidneys. Like kidneys. Kidney failure is,
Yes.
dead
Now,
kidney.
what is dead? And what do you do about the dead? You get rid of it. Whatever you. So once the gangrene sets in, that portion becomes black. Now I'll give an example of a mango.
Okay.
You have a mango on top of it become black.
Okay.
It must be attended to immediately. What you do with the mango? You chop that black portion off and keep it deep freeze because you want to eat it next day.
True.
If you don't keep it deep freeze, more portion will become dry. That is how the gangrene spreads. So CO2 laser is something which does the work of freezing where the organism don't supply. Laser, CO2 laser has revolutionized the treatment of diabetic foot.
I was about to come to that, doctor. Can you tell us, my last question would be, what are the kind of technologies involved today to help diabetics to either deal with a bad foot or to prevent a diabetic foot?
Prevent foot, you need a dedicated person.
Okay.
Most diabetics, even patient complain, they look at only the finger and they look at the piece of paper which is showing. They have no time to give them advice about the foot. Injury, how to prevent injury, how to have, what socks they should have, what footwear they should have.
Okay.
And they should control it at all times.
Okay. And what are the new technologies, sir? Can you tell us about that?
CO2 laser is something new. If you look up the net, you'll find the CO2 laser. I'm a pioneer for CO2 laser in India.
Oh.
And this prevents spread of gangrene. You cut away the bad black portion and apply laser. Laser kills germs. Now, if I just give you an example, suppose I got a laser and I point it towards your eye, you'll become blind. So it kills the germs. Well, what happens with antibiotics? You give so many antibiotics, they go through the side, very little amount goes there.
Okay.
But this is local treatment and completely prevents spread of gangrene. And we have been able to save lots and lots of feet.
Fine. That's about it. Thank you so much.